All right, well, thank you all for spending a few minutes with me here today. I come at this problem from a little bit of a different direction than pure digital health because our background is really in consumer behavior change. Lose It's an app that helps people lose weight, and we've helped about 25 million people make progress towards their goal since about 2008. And one of the questions we're always faced with, being who we are and what we do, is how should we think about user privacy? I mean, we're a consumer experience, first of all, and so, of course, we value that extremely highly. But we oftentimes are dealing with data that is right on the border of data that you might consider medical in nature, that you certainly consider private in nature. And so we have to think really long and hard about how we think about this problem. Now, as just an individual, as a person who's experienced working in the healthcare system and medicine, this is a little bit how I sort of have thought about privacy in my experience in the past, because most of the system has been optimized towards protecting privacy, and that makes sense. It's important to protect privacy. I think the downside of that is really twofold. One is sort of the consumer frustration that can come from that, and second, the sort of lack of interchange of data. Now, when the App Store was originated in 2008, a really big thing happened. And that is what was sort of this world of privacy became this world of privacy. And so how people thought about the apps they were using and how they interacted with them looked a lot less like a proprietary, secure, web-based email communication system and looked a lot more like how they think about Facebook. It's just an app. I'm just going to put it on my phone. I'm going to take it for a spin. And there's a lot that's great about that because it's allowed a lot of people to get a lot of exposure to a lot of technology and tools that they might not otherwise have for changing their habits and for changing their health. Now, an important question is whether or not privacy actually matters to consumers. And originally, when I put this slide together, I was thinking, well, this is great because there's this great study that shows how important privacy is to consumers. But I think part of what's fascinating about this slide is there's really two ways to read it. So one way to read it is, boy, 15% of people won't even download a health app if they don't trust the source of it. But I think the other way to read that is 85% of people actually will, or certainly 85% of people aren't thinking that hard about it. About a third of people will stop using a health app because of social sharing. And so privacy matters to the extent that it's about sharing data with sort of unrestricted social networks. But when you get to the medical side of things, then you start to actually see people starting to care, right? Because security can influence the choice of a physician, clinical trial participation, and so there's a real spectrum of consumer views on this matter. And I think part of what we're going to find is as we look at how consumer behavior changes over the years, the generations that are growing up now are going to have really radically different views than my generation and the generations that are older than me. But I think beyond just the sort of philosophic questions about where is the right line of privacy, how much control should there be, I think it's really important to note that there's a bunch of really boring and super important problems in privacy. And namely, when you put privacy control in place for people, even if you do a really great job, it ends up being really, really complicated. And I can think about this from two different perspectives. So Lose It is an app that helps people lose weight. One of the features we have is some great social networking features, but we have to give people control over exactly what they want to share with their peers. And so one of the hardest things we have to figure out is how do we do a great job of giving people that control in an experience that doesn't look like they're about to launch the space shuttle? A stack of 10,000 different checkboxes with 10,000 different possible options that they have to somehow sort through to figure out the kinds of choices and control that they'd like to have. I think HealthKit on the iPhone is another example of this. Apple has done a great job of putting privacy at the center of their health platform. But consequently, when an app like Lose It says, we'd like to read some data about the user, or we'd like to write some data about the user is presented with a really complicated experience for controlling it. And it's very hard for a user to understand what is the choice I'm making, what things should I be doing here, what are the consequences of what I'm deciding. And so it ends up being like a very complicated thing. Now, one of the reasons it's important to solve this problem is because sharing is so incredibly powerful. So in an app like Lose It, I think what we found, originally when we did the social features, they were driven in large part because we saw a study that showed that if you took tracking-based weight loss and you combined it with a peer support mechanism, the efficacy of the program was doubled. And so we're like, this is great. There's clinical research that shows this is going to be effective. When we put our social features in the product, very quickly, usage of our social features became the best predictor of a good outcome with our product. And so we knew if we can get you using our social features, you're going to be more engaged. Social features are built on sharing. It's just what you have to do in order to make social features work. But I think it also is powerful to share data across platforms. And so Lose It shares data. We write data to HealthKit, and that means other apps can consume the data we have. We have great partnerships with all the major apps and devices in the category. And that means data is flowing back and forth across all of these systems. And the user gets the benefit of this data being integrated into other systems. So when they go and they log into Fitbit, they can see the meals that they entered into Lose It. And when they go to Lose It, they can see how active they've been because their Fitbit tracker is connected, and they're seeing the data coming from Fitbit integrated into their Lose It experience. And I think thirdly, data is really valuable because there's a passive stream of it that can be shared with other people, and those other people can do things to help you. And so if you're not being active enough, if you're eating the wrong diet, that data now can be made accessible, and you can get really great advice from other people, professionals. And so getting sharing right is incredibly, incredibly valuable and important. I think the other way I think about how important it is in terms of clinical studies. And I think we've done a bunch of work recently with the National Institute of Health in terms of trying to take the Lose It data set and see what we could learn with it in conjunction with the NIH. And one of the things that really hit me was this is such a different kind of data set than most clinical studies are ever able to access. And so most clinical studies around weight loss are typically done longitudinally with small subsets of users that are highly monitored, right? What Lose It has is a big set of data, about 25 million users. They're in all walks of life, they're in all ages of life, that have all different goals. And while you get this huge volume of data, you get a little bit of the mess associated with it. You get a little bit of the inaccuracy associated with it. You get a little bit of the lack of control that you have with only 100 people in a trial. But it's a data set that is so immeasurably valuable and so hard for someone like the NIH to get access to. And so it becomes critical to say, well, it's important to share this data. We have things we can learn about how we can change people's habits, and sharing data is how we're going to figure these things out. The other example I like to point to is ResearchKit on iOS. And so we're based in Boston. MGH, Mass General Hospital, is based in Boston. They were doing a bunch of work around diabetes clinical research. And we started to get customers emailing us saying, we love that you're doing this stuff with MGH. It's so great that you're helping them with diabetes. And we were sort of like, we've never talked to those guys. I don't know what you're talking about. And it turns out because we were writing data to HealthKit and because they were using ResearchKit, the data that the users were using, that were putting into Lose It, were automatically being included, if they chose to, in the clinical studies being conducted by MGH. And so we didn't even need to talk to MGH. The user just had to give permission, and they were able to get access to the data from basically a very, very productive consumer experience. Now, so where does this leave us? So we've got this world where we say consumers may or may not really even care about privacy. Privacy is really important. It's very hard to get convenience. It's very hard to make simple. And I think there's a couple really, really big takeaways about privacy. I think one is, in the end, the customer is always going to win. And in the end, that sort of the convenience of the experience and the productivity of the experience is going to be overwhelmingly important. In fact, I think it turns out that the convenience of the experience is going to drive engagement in the experience. And the convenience of the experience is going to drive adherence to whatever it is we're asking them to do. And the convenience of the experience is going to drive utilization and engagement. And so I think the first thing is, if we envision a world where we're protecting privacy and it's incredibly inconvenient, that world is not going to come to exist. We need to envision a world in which we have thought through the privacy concerns, but in the end, we've said we're going to focus on convenience. We're going to make the data move, because in the end, that's where most of the value comes from, and that's really what consumers are thinking about. They're thinking about, how can I get these things connected? How can I get that next set of value? When I started, I sort of thought, well, there it is, that's it in a nutshell. But really the natural next question is, well, so what does that look like? You said it didn't look like HealthKit because that's too complicated. So what does it look like? And I really don't know the answer to that question. Our version of privacy today is a lot more like HealthKit than it is something simple and convenient and wonderful. But you do wonder, maybe did Facebook have it right? You know, where you simply say, I'm going to sign in with Facebook, and it just says, here's the 4 things you're going to give this person access to do. Do you want to do it or not? And you just say yes or no. And if you say no, they get nothing. And if you say yes, they get what they need, and off they go. In any event, I appreciate you guys hosting me today. I appreciate being up here. I look forward to any questions folks have afterwards in the back. I'll be available, and thank you very much for listening.
Thank you. I do think the